A 7-night Western Caribbean cruise, which departed Galveston, Texas on Sunday, called to port in Belize on Thursday morning after leaving Mahogany Bay, Honduras several hours earlier.
Yesterday, we had just a little over 3,700 passengers and crew on board.
Also on the Carnival Magic was an unidentified passenger, an employee of Texas Health Presbyterian Hospital, whom it is believed may have had contact with specimen from now-deceased Ebola victim Thomas Eric Duncan.
Traditionally, we have 85% disembarkation rate from the ship.
While a majority of those visitors landed at the 4th Street Tourism Village, the traveler, as well as another unnamed individual, for health and safety reasons, voluntarily isolated themselves from the ship's population. Sometime later, an overseas phone call was placed to CEO Audrey Wallace.
The Office of the Prime Minister received a call advising that the State Department would like to have an urgent call with the CEO in the Office of the Prime Minister. That call came in at 9:40 a.m., and it was a conference call that included the U.S. State Department in Washington, where a doctor was on the line, the U.S. Embassy in Belize, and myself. I was informed that a healthcare worker from the Texas Health Presbyterian Hospital, who was listed as low risk for Ebola by the Center for Disease Control in the United States, was on board a Carnival cruise ship that landed in Belize in the morning.
The exposed staffer, who may have handled Duncan's bodily fluids 18 days ago, is yet to exhibit symptoms of the deadly virus. However, in the wake of several mistakes made by the Center for Disease Control and Prevention in dealing with Duncan's case, there has been a significant change in approach.
They explained that the CDC had updated its requirements from self-monitoring for these low-risk persons to active monitoring, which would require them to be in the United States to be monitored. They explained that the employee had been checking daily for a temperature or any other symptom of the disease and had none. The doctors on the cruise ship examined her and confirmed that she had no temperature or any other sign of symptoms. The healthcare worker, along with her traveling companion, agreed to self-quarantine on the ship. I was further advised that it had been 17 days since the worker would have possibly been exposed to Ebola virus.
With an incubation period of up to 21 days, she would still not have been free of consequences from exposure to the Ebola virus. That being said, a request was made by the U.S. State Department to have them medevaced from the Philip Golson International Airport.
I was then asked for the government to allow the passenger and her companion to disembark and flown out of the PGIA on a private plane. They explained that they were taking this action out of an abundance of caution and not because anyone was at risk. I informed them that I would get back in touch. The Prime Minister was informed of the situation and the request. Immediately, he expressed deep concern over facilitating the movement of the 2 passengers from the cruise ship to the PGIA. Although fully aware that the disease can be spread only when an Ebola patient is sick, he was most concerned about exposing any Belizean to any potential risk, no matter how far-fetched it may be.
Notwithstanding those concerns, immigration officers at the port of entry at FSTV were tasked with handling the pair's travel documents. That was done under strict instructions.
The immigration officer was advised at all times not to have any handling of the passport.
Meanwhile, discussions were being held with Health and Coast Guard officials to examine the possibilities of the initial request.
The Office of the Prime Minister sought the advice of the Ministry of Health and subsequently entered discussions with them and the Coast Guard to explore the logistics of moving the 2 passengers in a way that could pose no risk to any Belizean.
When those possibilities, including medevac by private charter, were all exhausted and found to be unsatisfactory, Prime Minister Barrow would adamantly decline the request of the U.S. State Department, despite a personal appeal from Secretary of State John Kerry.
At about 1 p.m., the U.S. Embassy advised the Office of the Prime Minister that they had some delays with the plane, which would not be able in any case to come to Belize until the following day, Friday. The U.S. was asking for the 2 passengers to be disembarked and held in quarantine in Belize terrestrial soil until Friday morning, when the plane would medevac them to the U.S. When informed, the Prime Minister immediately said no to that request, being of the view that it would assuredly expose at least Belizean healthcare workers and security personnel to some risk.
The aircraft would still arrive in Belize in spite of advice from government that it should return to the United States. Reporting for News 5, I am Isani Kayatano.